You rush to the emergency room and the doctor says, "Papers, please." If a group of state lawmakers has their way, Arizona hospitals will have to ask certain patients to prove they are here legally. In tonight's 9 on Your Side Immigration Watch, hospital hassle. Kevin Keene in the newsroom to explain this proposal and the controversy.
I'm going to use myself as an example here. Under this proposed state law, if I go to a hospital and don't have health insurance, staff there would need to ask me for my ID proving that I am here legally. If I don't have that ID, they'd have to call the cops.
Each of the 4 Republican sponsors of House Bill 2293 said they were unavailable to talk Friday. State Representative Steve Smith spoke with the ABC station in Phoenix Thursday.
It's a data collection bill.
Smith says his goal is to track how much money hospitals spend treating undocumented immigrants.
How much money does Arizona spend for illegal aliens per year? And the answer is really simple. We have no clue.
The bill would require hospitals to keep a tally and report to the state.
We don't really understand the overwhelming desire or need or benefit to collect that data.
I spoke with Pete Wortham, who represents hospitals across the state, including Tucson. He argues this proposal would delay care for all patients.
Immigration review and citizenship verification is not something like just as easy as checking a driver's license.
I think it is a draconian bill. It is, it's even worse when I read it in detail.
Also in opposition, Dr. Norma Price of the humanitarian groups No More Deaths and Samaritans.
I think the whole bill comes from a position of hate. It divides the community. It vilifies a segment of the community and puts them in fear, and they are less safe.
Price argues undocumented immigrants fearing deportation will not seek health care when they truly need it, a public health concern Wortham shares. Both also believe the proposal shifts immigration enforcement.
So that's turning the hospital into an agent of the government, and that's wrong.
Representative Smith sees it differently.
They're not withholding care, they're not deporting, they're not throwing out, they're not doing anything. We're just logging information.
This controversial bill is in the early stages of possibly becoming law. The sponsors have introduced it, and now it needs to be assigned to a committee. If you'd like to read it in its entirety, it's 1 page long. We've posted a copy on our website, KGUN-9.com.
Now, the lawmakers said they're just logging information, but the question is, what would they do with that information?
Good question, and this bill doesn't answer that. All it does say is that a yearly report will be sent to the governor, to the Senate, to the House every single year with the total number of these hospital visits by undocumented immigrants.
Kevin, thank you.